Hi guys, Dr. Kalika and Dr. Ajakwa from NYDNRehab today, and we want to talk about the neck. I know a lot of you sitting looking at the screen all day long, and you type on the computers, and then you come back and you're on Instagram and your iPhone, and then you have your neck pain, and then you think that you need a massage, or you need some acupuncture, some stretch, maybe manipulation. And maybe you need a little bit of that as well, but that's a very narrow-sighted approach to neck pain. So what we lose when we have neck pain and when we have that posture and when we overuse our eyes looking at the screen, we lose neck proprioception. And the muscle control and how much force and activation of the neck muscle comes from sensation where you are. The neck is made of a lot of receptors in the neck joint. So the proprioception of the neck comes from those facet joints in the neck. Also comes from the muscles, the fascia, and also comes from syncing your eyes together with your neck movement. And so we have a proprioceptive training here, and the training has multiple degrees of difficulties. And that is just one way we use a neck retraining. So we're going to demonstrate how difficult it is to do this and how it changes your brain to see what muscles to use after this training. So now Michelle, she has a gyroscope inside of this head, and this gyroscope is allowing her to play this game and to fine-tune the force in the muscle to figure out what's the neck position. And you will see how challenging that is. So can we please start the game? All right, so you're on, Michelle. And you could see she overshoots, so it's not that easy. So she's actually looking in the mirror. So she sees the screen in the mirror in front of her, and you could see how very difficult it is for her to make the movement smooth, how fast she goes from flexion to extension. Can you try to make the movements a lot slower? The slower this ball will go, the better it is. So try it again, keep it very slow. She overshot. Go back to neutral, to here. Her brain is solving the puzzle, what to do. And in the process of solving this puzzle, she trains the proprioception. She trains the muscles, and she trains the brain. So come again. And the therapist is trying to give her the clues on how to move best within this. But first I want her to figure out how to do this. And she's doing it the first time, by the way. Slower, 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 slower. Control, stop, go back. Nice, nice. Circumduct. Slower. And if you can see, she's doing it second time around. Oops. Too fast. So proprioception is really important training. If you can see how difficult it is, and if you repeat this, repeat and repeat, your muscles will relax. If you know how much force to use and which position your neck is, then you know that you don't need the tension. You don't need too much force. So altogether, proprioceptive training is an amazing way for people with neck pain, especially for people with chronic neck pain. And we use this technology for low back pain as well, for other things, and we combine it. If you can see this chair swivel, and we combine it with other technologies, and the therapist also gives correction. Thank you very much. See you in the future.